It's truly inspiring what colleagues do in our field. And sometimes it's a thankless job. I felt it's an incredibly rewarding program. And it really is for the exceptional nurse who gives beyond measure.
I think the wonderful thing about nursing is that we don't realize what an impact we have on people's lives when we're just doing our day-to-day jobs.
They're very eager to recognize their colleagues. Sometimes they're doing above and beyond what is expected and normal or everyday events.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm Erica Fischer-Cartlidge, ONS Chief Clinical Officer, and your host for this episode. Today, we will be speaking with ONS member and DAISY recipient Laurie Rudolph, her nominator Jamie Stern, and Magnet Program Manager Kathy Garrison. DAISY Award recognitions honor the remarkable work nurses do for patients and families every day, wherever they practice, in whatever role they serve, and throughout their careers, from nursing student through lifetime achievement in nursing. ONS is one of the DAISY Foundation's supportive associations. You can also earn free NCPD contact hours by completing the evaluation we've linked in the episode notes. Thank you for joining us today, Laurie, Jamie, and Kathy. Let's start with some introductions. Can you each tell us a little bit about your careers in nursing?
Good morning. This is Jamie Stern. I've been a nurse for 22 years. My career started in New York on a med-surg floor, then moved up to telemetry, and then found my true passion in critical care. My husband found a job as a firefighter in the Virginia area, and our path brought us down here to Virginia. I worked in a critical care area, then changing roles to a float pool nurse, which did a variety of things from mother, baby, behavioral health, ER, and critical care. And I'm currently now a nursing supervisor.
Hi, I'm Kathy. Thanks for inviting us. I've been a nurse for 43 years in a wide variety of areas over that time frame. I started out in burn ICU and step-down unit. I did a little home health, went into emergency nursing, which was a passion of mine as well. Then became a clinical educator in the professional development area at our local hospital, and a short stint in quality improvement, which is important, but took me away from the bedside, far, far away. But that experience and all the others have done me well in my current position as the Magnet Program Manager for our community hospital.
Hello, I'm Laurie. Thank you for having us. We appreciate it. I've been an oncology nurse for 24 years in a variety of different roles. I was a floor nurse, an infusion nurse, and for the last 15 years, I've been a breast care nurse navigator, which is my true passion.
Thank you all so much for sharing. You each have unique and different paths that led you to where you are today. So let's start here. Laurie, have you and Jamie ever worked together before? Can you tell us a little bit about how your paths crossed for her to eventually become your nominator?
Sure. Jamie and I haven't worked together before, but we work in the same hospital and we are on nursing committees together and we've done community outreach projects together. So Jamie knows of my role as the breast care navigator here at the hospital. Unfortunately, her mother was diagnosed with breast cancer last year and Jamie reached out to me because she was aware of, my role, and she was asking for my help in managing her mom's care. And it was a little bit complicated because her mom was in New York. And she wanted to come down here for her treatment so she could be closer to Jamie and Jamie could help her get through all her treatments. So I just assisted in getting her, a surgical consult and coordinating some of the tests and appointments that she needed here to get her started on her treatment.
It must have been really reassuring, Jamie, to have a colleague that could help facilitate things during a stressful time. As a nurse, I know it can be very challenging to go from being a caregiver of patients to a caregiver for your own loved one. What was that experience like for you?
Yeah, it was great to have the resources and to sort of have the insight to the nursing world, but it also brought up many past experience and many past patients that I've had in the past. So, as a nurse, you see the worst, you're in with patients at their worst and best times, and you hope it never happens to you or your loved ones. But when my mom received her diagnosis, it was truly terrifying. I don't have any true oncology experience and know very little about most of the treatments. My parents still live in New York, and when my mom told me it was over the phone, and all I wanted to do was be there for her and hug her. I immediately thought of Laurie as, seeing her function as the breast center navigator, and immediately called her. We've not worked in patient care together, but I know she is an amazing nurse and amazing facilitator of care. So it was very reassuring in that aspect when your specialty is not what your loved one is diagnosed with. She was there to answer all questions. She was there to, help me work through whether it would actually be feasible to bring my mom down here, which it was, and especially with her help. Laurie has also worked with many foundations to help her patients, that including the Stepsisters Foundation in our Northern Virginia area. She has helped people pay their mortgages when they were sick and has been a great resource, not only for obviously her colleagues, but for many patients.
Thank you so much for sharing that with us. I can absolutely see why you'd want to express your gratitude for Laurie's support through your mom's care. Tell us a little bit about why you chose to do it with a DAISY nomination.
Nursing can be both rewarding and not. We deal day to day with beautiful stories and terrible stories, and we can have that from 1 minute to the next. It's truly inspiring what colleagues do in our field. And sometimes it's a thankless job. You don't always see the patients from, start to finish and get to celebrate with them. So in this case, I felt DAISY it's an incredibly rewarding program, and it really is for the exceptional nurse who gives beyond measure. And, my late night calls, 8 p.m., 9 p.m., 7 o'clock in the morning is definitely beyond measure of her role as the breast cancer navigator. So I just wanted to show her my gratitude, and the DAISY Foundation is a great award to give somebody that has done an exceptional job.
Thank you. So Kathy, you are the program manager for Magnet. I have noticed many organizations often pair recognition, nursing recognition, with that kind of Magnet area of the institution, which when you have that big document, I always think the recognition programs are the nice perk that you get along with that to be able to be part of those celebrations. So that's exciting. And UVA is one of 5,400 hospitals in the US that participate in the DAISY Award program. Can you tell us a little bit about your hospital's decision to participate and how you bring this to life so that individuals like Jamie can express their gratitude for nurses like Laurie?
Absolutely. Prior to making the decision to join DAISY, we did have a Nurse Excellence Recognition program, but it was a homegrown one, and it was really fed by leaders, not the clinical nurses. So after getting a lot of feedback from a lot of our clinical nurses who had either participated in the DAISY program at another facility in a prior job and learning about it online, the organization made the decision to join DAISY. So we did that in 2019. It was one of the first projects that I facilitated as a Magnet program manager. That's the year I started in this position. So it was exciting and rewarding to work with a group of nurses to give it our own little flavor, so to speak. The foundation, the DAISY Foundation, when you're honored by a DAISY award, it's not just your facility that learns about it, your family, your peers. You are posted on the website, and it becomes a national and international recognition of the wonderful job this individual nurse or a team of nurses has done. To see the expression of pride and honor and joy when somebody receives the DAISY award is so great to witness. In fact, the first probably 4 or 5 awards that we give, and we give them quarterly or try to give them quarterly, I could not read the script of the DAISY award that they give us without crying. It was very difficult, but it was also touching and meaningful. And as Jamie said, our practice environment today in nursing is so stressful and difficult, but the nurses continue to show up and do their job every day to the very best of their ability. And, we're seeing some burnout and moral distress taking its tolls on our colleagues. A lot of them have left the profession with COVID and all the sequelae that has resulted from that the pandemic. So recognition programs such as the DAISY has a huge impact on our nurses as far as keeping them engaged, keeping them happy and resilient. If you go to the DAISY website, you'll find lots of evidence because nursing practices in an evidence-based world. So there are tons of articles and studies that have showed how recognition does help a nurse remain resilient and passionate in her duties. And it was an organizational community event when we joined DAISY. I just have to call out all the folks that helped me. Our volunteer auxiliaries helped pay for all the boxes that we distributed around the facilities to collect the nominations. I had clinical nurses and some leaders. One of the clinical nurses had her husband build like a rural mailbox, complete with a little picket fence around it and silk daisies that we put in our lobby to collect the paper nomination forms. And then our community has a large Spanish-speaking population. So it was suggested and, recommended, and we acted on it that we translate our paper nomination into Spanish for those folks who might not be able to read English.
That sounds really amazing. I would love to see that mailbox in the garden. And I really love that you committed to it and translated the lobby display so that it meets your patient populations where they are. So how many DAISY Award honorees have you had since starting in the program? And do you find most of your nominations are from peers or from patients?
I believe we've had 12 individual DAISY honorees since our inception. Obviously, during the peak COVID months with no visitors in the building, the nominations fell down a bit. But we kind of substituted, or not substituted, but we still wanted to recognize nurses. And instead of doing the individual awards, we ended up doing a team award. And we've done 2 of those because the stories were just amazing examples of how nurses took a patient's wish or desire or situation and acted upon it and made it happen with a team effort. And it was just touching.
That's wonderful.
This year, we are going to try and relaunch DAISY in both of our facilities because we've had a lot of turnover and we want to kickstart it again.
Oh, the idea of a relaunch is such a great idea. I think it really can help with sustainability. And as you mentioned, get some of the new staff who may be unfamiliar with it on board. I find that nurses are always so surprised when they receive a nomination for a recognition like this. Laurie, what was it like for you to find out that you had received a DAISY Award?
So Jamie sent me a copy of her nomination, and it brought me to tears. It was so sweet. I think the wonderful thing about nursing is that we don't realize what an impact we have on people's lives when we're just doing our day-to-day jobs. And we are always striving to provide the best care that we can to every patient and family. But like I said, I think that there's an impact that we don't really truly understand until you see something like that and you get that kind of letter. I can't tell you, it means the world to you. And as far as getting the actual award, that was unbelievable. The DAISY Award presentation is truly unique and the most special thing you can be a part of, I feel like, as a nurse. I was blown away. My family was here, which I was not expecting. Like so many peers and people from all over the hospital were here just, to congratulate me and support me. Flowers, the treats that are part of the story of DAISY. It was just so special. And I've never felt so appreciated and honored in a work setting.
Did it mean something different having the nomination come from someone who's also a nurse?
Absolutely. Yes. And especially Jamie. I have so much respect for Jamie. She's an incredible nurse. And, to have that nomination come from her, it validates you, I feel like, in your career. And also, just among your colleagues, that they respect you as well and they admire you as well. I think it's the highest recognition that you can receive, really. So I was, like I said, I was blown away and I was so grateful. And I was so happy that she and her family felt that way and that her mom felt that way in particular.
There's a lot being written lately with everything happening with burnout and staffing and about the impact of gratitude in the workplace and how it benefits both the person receiving the gratitude and the individual expressing it. Jamie, what were you thinking and feeling when you found out that Laurie's nomination was selected for an actual honor after you had been the one to nominate her?
Yeah, I mean, I was elated to hear that the committee that reviews the nominations selected her. But also on the other sense, I sort of felt like it was no competition because of not only, the support she gave us in her clinical role, but the support that she gave us, when my mom talked to her, it was like she was talking to a friend. I was on some calls with my mom, with some other nurses and some practitioners just when she was in New York. And I felt the difference in the way that Laurie approached things, listening, understanding, just being there as a support for all of us. So I was so excited to celebrate her. And my mom was actually able to be here from New York. And it was just a great celebration.
It sounds like it was a lot of fun. Kathy, do you find that nurses are eager to take advantage of opportunities to express gratitude for each other? And what other options do they have in your institution beyond DAISY?
The simple answer to that is yes. They're very eager to recognize their colleagues. And when they see something and their colleague would be like, no, like Laurie mentioned, I'm just doing my job. But sometimes they're doing above and beyond what is expected and normal or everyday events. We do a lot of celebration. We find it's very helpful to keep morale and engagement up. Our CNO is a great supporter of all her nurses in all ways, this especially. She and I do a presentation at every nursing orientation where she speaks about resiliency and goes over all of the behaviors that help a individual to be very resilient, and gratitude is one of them. So she always speaks about it, and she not only teaches it, speaks to it in her discussions, but she practices it as well. It's not unusual for her to send random text messages or call up and say, hey, I just wanted to say thanks for yesterday, or thanks for what you did, or I heard you did something. We also have a organization-wide recognition program that when it was developed, they actually reached the leader of that group reached out to me and to ask me, how does DAISY do it, so that they could mimic some of the best practices that DAISY uses. So we do that. We also have a daily safety call that at the end of it, after we get through the business of the meeting, it lasts 15 minutes. That's it. And Jamie participates on a lot of those since she's a nursing supervisor. But the last thing that we end a call with is any celebrations or announcements. And just today, for an example, a leader shouted out a thank you to another team member who did an exceptional job working to fix a piece of equipment that was critical and get it up and running in a very quick way. So we celebrate each other as much as we can because we realize the gratitude helps feed our soul and keeps us coming back every day. We also have thank you notes. They're just little cards. They say thank you on it. And we have them around the organization. Anyone can pick up a card and write a little note. And lots of times they end up in the DAISY mailbox because nobody knows what to do with them out. Like a visitor doesn't know where else to put them, but we make sure that they get to deliver to who they need to. And we also celebrate the nominees who don't win the DAISY award. And that is not as grand as the DAISY Honoree Award, but it is celebrated on their unit with their peers in a very positive way. So we try and keep the spirit alive.
Those are such great examples, Kathy. Thank you. Personally, I remember the first time a peer nominated me for an ONS award and how overwhelmed I was at the feeling of gratitude that they would take their time to do that for me and recognize my contributions. Knowing how it felt to be on the receiving end, I was so eager to go that extra step for others and recognize one of my colleagues the next year. So gratitude really can have that ripple effect.
It does.
In a time when there are really high levels of burnout and challenges across the country, do you feel that the importance of expressing gratitude in the workplace in one way or another is greater now than it's ever been?
I think it is. I think even with COVID, I felt like there was so much more recognition and appreciation for nursing at that time. But as far as, our day to day, it's always so important that we feel that appreciation. That's not what we do our job for. We do our job because we're passionate about it. But when you know that you have touched someone, you have made their life easier, you've helped to guide them through a very difficult time in their life, that is the most gratifying thing to me that any kind of recognition I could ever receive. And I feel like I get that so often from my patients, which is why I love oncology so much. They're so grateful and hopeful And that is why this is my passion. So to get recognition from my peers as well was just really, truly icing on the cake for me. Our goal always is to make sure that every patient and family feels special, and they're our main priority.
That's great. Thank you. In the spirit of gratitude, I cannot thank you all enough for the time today and sharing such important perspectives on gratitude and the Daisy Award experience. For those interested in learning more about the Daisy Foundation or workplace gratitude, we've included some great resources for you in the episode notes. And I would encourage you to think about a coworker, friend, a family member, someone in your life that you may have something to be thankful for and express your gratitude. We know it's benefited Kathy and Jamie and Laurie to be part of such a healthy culture of workplace gratitude. And we certainly know that it can benefit you as well.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.